Okay, so you have 42 minutes. Oh, we're recording right now. Okay.
We can crop that.
Scanning the room. Alright.
Come in. I'm going to shut the door for the patient's privacy. Hello, my name's Tyler. I'm going to be a student nurse today. I'm going to come over here and wash my hands. And then, can I see your wristband, please? And what is your name and date of birth?
Gerald Holden, 22296.
Okay. And do you have any pain?
No.
And do you have any allergies?
No.
And are you comfortable?
Yes.
Okay. Today we're going to be doing a head-to-toe assessment on you. Do you know what year it is?
2016
Do you know why you're here?
for a head-to-toe assessment.
Okay. And do you know where you're at?
University of Detroit Mercy.
Patient is alert and oriented times 4. Mood is calm. Affect is flat. Patient appears stated age, and no obvious signs of illness. Is it okay if I remove your glasses?
Yes.
Go ahead. And I'm going to feel the head. Skull is hard, no soft spots, normal cephalic. Hair is evenly distributed, normal for ethnicity, fine, a little bit greasy. And the face is warm and dry. No signs of lesions, or I would use the ABCDE method to grade the lesion. And now I'm going to do the eyes, nose, and throat. And go ahead and just look straight ahead for me. And then go ahead and watch my pen light. Pupils are equal, round, and reactive to light and accommodation. Actually, I'm going to need this. Nose is midline on the face. Can you go ahead and open up your mouth for me? No coatings on the tongue. Hard and soft palate are moist and pink. Linings of cheeks are moist and pink. No cavities. Can you say ah for me?
Ah.
Uvula is midline. Tonsils 2+. Gums are intact. No bleeding and pink. And no signs of receding gum lines. Right. You go ahead and smile for me. And puff your cheeks out. Right. And then go ahead and close your eyes. And let me know where I touch you on your face.
Right cheek, chin, forehead, left cheek.
Cranial nerves 5 and 7 are intact. And now I'm going to auscultate the carotid arteries for any bruits. One at a time. Go ahead and hold your breath when I put the stethoscope on you. Go ahead and take a breath. And hold your breath when I put the stethoscope on. No bruise detected. And now I'm going to palpate the carotid arteries one at a time. Carotid arteries are equal bilaterally 2+. And now I'm going to go to the lung, heart, and bowel sounds. I'm going to start with the anterior lung sounds. I'm going to take a few deep breaths. Breathe normally now. Lungs are clear and vesicular, equal bilaterally on the anterior. And now I'm going to listen for the heart sounds. And I'm going to listen at the second intercostal space on the right sternal border for the aortic. The second intercostal space, left sternal border for the pulmonic. And the second intercostal space, left sternal border for the herbs. The fourth intercostal space, left sternal border for the tricuspid. in the fifth intercostal space, mid-clavicular line for the mitral, and that's where you would listen for the pulse for 60 seconds. Okay. Now I'm going to go backwards with the bell to listen for any murmurs. No murmurs heard. You can go ahead and go over to the end, and I'm going to listen to the posterior lung sounds. And take a few deep breaths for me. Go ahead and breathe normally. Posterior lung sounds are clear and vesicular. And now I'm going to do the costovertebral angle. Let me know if you have any pain. Any pain?
No.
Okay. What about on this side?
No.
Okay. And then if you could bend over for me, I'm going to do the spine curvature. Spine is straight. And if you could lay down for me, please. I'm going to listen for the bowel sounds. I'm going to look on the stomach or abdomen for any lesions or growths. You go ahead and pull your shirt up for me. So hair is evenly distributed. Temperature is warm. No lesions or growths on the stomach. And I'm going to auscultate for bowel sounds in all four quadrants. Bowel sounds are present in all four quadrants, and I'm going to palpate for any tenderness. Let me know if you have any tenderness. Here?
No. 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 No.
No tenderness. And I'm going to percuss all four quadrants. I felt dullness over the liver and tympany over the other three quadrants. And in the right upper quadrant, we have the liver, gallbladder, and the right kidney. And in the left upper, we have the left kidney, the spleen, and the stomach. The left lower, we have the left spermatic cord, the sigmoid colon, and the left ureter. And then in the right lower, we have the right ureter, the right spermatic cord, and the appendix. You go ahead and sit up for me. No JVD detected in the carotid arteries when sitting up. And now I'm going to do the upper extremities. No signs of abrasion or any growths, just some freckles. Skin is normal for ethnicity. Hair growth is evenly distributed, and temperature is warm. Skin is dry. I'm going to do capillary refill on all 10 fingers. Capillary refill less than 3 seconds on all 10 fingers. Now I'm going to feel for the radial pulses. Radial pulses are equally bilaterally 2+. Now I'm going to do the brachial pulses. Brachial pulses are equal bilaterally 2+. And now I'm going to do the... first I'm going to assess for clubbing of the nails. So you go ahead and hold your nails up just like that. No clubbing of the fingers. And now I'm going to do the lower extremities. So first I'm going to come out a little bit further so I can do that. I'm going to feel for the popliteal pulse behind both knees. Popliteal pulses are undetectable. Could not find. Temperature is warm on the legs. Dry skin. Hair growth is evenly distributed and no abrasions or lesions. And now I'm going to feel for the... actually, I'm going to need you to take your shoes and socks off for me. Okay. Now I'm going to feel for the posterior tibial pulses. Pulses are equal bilaterally 2+. And the pedal pulses. Equal bilaterally 2+. And do capillary refill on all 10 toes. All less than 3 seconds on capillary refill. Now I'm going to do the Babinski test. So give me this foot first. Babinski test negative on the left. Babinski test negative on the right. And if you want to go ahead and stand up for me. And this is where we do the Romberg test. He's going to close his eyes for 20 seconds. Go ahead. And we would be here for 20 seconds. And then if you want to go over and just walk straight to the window and back for me. All right, thank you. Gait is steady. And where is it?